It is right now 4:45 in the afternoon. We have more Massachusetts families struggling to put food on the table more than ever before. That is according to a new study that's done by the Greater Boston Food Bank. As you can see, Dr. Todd Eller of South Shore Health is here with us to talk about this because I'm going to make a statement. It's a big issue, period. Just how big an issue is it, in your opinion?
It's a very big deal. In Massachusetts, the study showed that 40% of households have food insecurity. That's over 1 million households. It's not evenly distributed. Hispanics number one, LGBTQ plus households number two, blacks number three.
Is there a definition of food insecurity? What establish you are food insecure, you're food secure? Is there a clear line?
I mean, obviously, there's not a clear line, right? The study has definitions, but the bottom line is this. As you know, food insecurity leads to chronic health problems like obesity, like diabetes, like heart disease.
Right.
How is that possible if you're food insecure? How are you obese? Because you're getting cheaper food that's high in calories, more processed,
That's
right?
Exactly right.
But not as nutritional.
That's
and
exactly
then that
right.
feeds each other.
So what are you seeing in your own patients when they don't have not only consistent access to food, but consistent access to food that's good for their system, for their human body?
Right. Well, first of all, let's take children, for example. In this study, 1/3 of households, children, are food insecure. What happens to that? Not only do they have also chronic problems like asthma, but think about it. Think about your child or an adult. You don't know where your next meal is coming from. What does that lead to?
Right.
It leads to anxiety, depression, stress. You do poorly in school. So it's this vicious cycle.
Domino theory. In 2026, it's just shocking to me. So, and it isn't just about hunger. How does the impact, you were just talking about the domino effect that it has. Well, how does it impact the broader healthcare system?
The study also showed that there's a significant increase in ER visits and hospitalizations in children and adults who have food insecurity. So that's a huge, right? That really stresses our system. Now, why might that be? Because think about it. When you have to put money towards food, what aren't you putting the money towards? Right? You're not filling your medications. You're skipping your doctor visits and things like that. You're going to the emergency room as, when you have other issues that if you weren't thinking about food, you'd be able to take the medications that you need. Go to the visits that would prevent other problems.
Dr. T, thanks for seeing us today.